Hepatitis C screening remains one of the biggest challenges in hepatitis C. Now that we have tremendous medications that can cure nearly 100% of patients, the big challenge is to diagnose these patients. We know that there are several million patients with hepatitis C that are not aware that they have this condition, they have not been diagnosed, and in an effort to bring these patients to diagnosis and therefore to treatment and cure, the CDC and the U.S. Public Health Service issued a strong recommendation about 2 years ago that the generation of baby boomers individuals, that is, persons having been born between 1945 and 65, should have a test for the hepatitis C antibodies at least once. Unfortunately, these recommendations have not been followed so far to a point that we have high rates of screening. In fact, the most recent data suggests that perhaps about 20 to 30% of baby boomers are being presently screened, with 70 to 80% of them not being screened for hepatitis C. So this is an urgent need to devise strategies that will increase the rate of screening by primary care, family physicians, and in fact all kind of medical specialists. I think it's going to involve a concerted effort, including education, incorporation of hepatitis C screening in quality assurance programs at the level of individual practices. Well, for the next decade, I think that we are going to see the gradual control of hepatitis C, and perhaps by the second decade, the hope is that we confine hepatitis C to a place of being a rather uncommon and rare disease. I believe that fatty liver will be the very next big liver disease, simply because of the sheer numbers of persons who are affected by fatty liver disease.